Good afternoon, and thank you for joining us today. My name is Bianca Bell. I'm one of the Home and Community-Based Services admins. I work out of the Behavioral Health Division, and I work alongside Dawn Pearson and Melissa Clockey in the development and the implementation of the 1959 services. Today, I'm going to be facilitating the training along with Janelle Walton. Janelle Walton is a provider enrollment specialist with the Medical Services Division, and she's really our subject matter expert when it comes to answering any questions that you might have about provider enrollment. So I'm just going to remind everybody too, this training is going to be recorded. The training will be posted online along with any of the materials that you'll see inside of the training today, as well as any of the questions that are being asked. We will track the questions and provide written answers if we're not able to answer them right away for you in the training today. So the purpose of this training is really to ensure that we're providing everyone with the resources and the support that they need to complete the provider enrollment process. Starting September 1st, providers will have access to the resources we'll be discussing in the training, and they'll be able to begin the paper process and the online application for provider enrollment. And again, the goal of the training is really to provide an orientation of the process. We won't go in deep detail because the process is going to vary depending upon your business type and structure. This is really meant to be a navigation of where to access the different resources and forms that you'll need, as well as answer any questions that you might have regarding the process. We'll do this by giving an overview, identifying key steps, as well as going through some of the resources that we'd like to share and answer any questions. I'm going to ask that you please hold your questions until the end because we want to make sure that we are able to get through the materials, and we have set aside time at the end to answer any questions. We did have a session earlier today. We were able to get through the slides quite quickly, so it might not take the full hour and a half, so we will have plenty of time for questions at the end. Also, if you're not sure of the questions that you want to ask, we'll give you some information on who and where you can contact to ask those questions. So before we dive in, it's important to know that home and community-based behavioral health services are basically services that are designed to help individuals with accessing the greater community. So essentially, the services themselves are developed to help people overcome the barriers in their social and physical environments. It's also important to know that there are several departments and divisions that make up the state Medicaid agency when it comes to the service delivery piece of this all. And for 1915I specifically, this includes the 1915I Program Administration and Policy, which is with the Medical Services Division as well as the Behavioral Health Division, Medicaid Policy, which is with the Medical Services Division, Provider Enrollment, our Medicaid Expansion Group, Billing and Claims, and MMIS, Quality Assurance, and our Human Service Zone Eligibility staff. We recognize how essential the providers are in delivering the services, and really it's important that we share that with you because we do understand in order for these services to be delivered and be successful, it does take the Medicaid agency, the zone staff, as well as the providers that enroll to provide the services. The provider enrollment process is conducted by the Medical Services Division by the Provider Enrollment Team. This process ensures that enrolled providers complete and submit the documentation that verifies adherence to state laws and federal rules and regulations. So to provide 1959 services, all providers will have to complete the enrollment process. As mentioned, 1959 services are Medicaid state plan services, and agencies and individuals providing services are subject to state and federal laws, rules, and regulations. It's also important to know that providers, including individuals and groups, may be enrolled to provide one or multiple services under 1959, as well as any waivered or state plan services. Providers who are enrolled will be required to revalidate their enrollment every 5 years. And some people on the call I know are already, or who may be already enrolled with Medicaid, might be wondering, is this process going to be relevant to me? And it's important for you to know that already enrolled providers are required to enroll for 1959 HCBS services with a new application. Providers will be enrolled with a new Medicaid ID for these services. So when you're going in and you're billing, 1959 services is its own specific group. So that is why you will need a whole new Medicaid ID for these services to enroll into that group. There are 3 types of enrollments: individual, group, and sole proprietor. An individual enrollment is completed by a person that is employed by an agency. A group enrollment is completed by an agency interested in providing and billing for 1959 services. And the last provider type is a sole proprietor. And a sole proprietor is a combination between individual and group enrollment. So individuals who would be a one-man shop or wanting to be, you know, add to their already private practice, those individuals would be required to complete both the individual and the group enrollment process. It's best practice for agencies to assist individuals in completing the enrollment process. We recommend assigning this task to one person in your agency if possible. This will allow for the efficiency with completing the process and eliminate any potential mistakes and frustration. So we've broken the provider enrollment process down into 5 steps, and Janelle and I are going to take the time to walk through each step. The first step in the process is obtaining a national provider identifier number. The second step is completing the provider enrollment checklist, and that is a paper checklist that will be found online. We'll talk more about that. The third step is completing the online application through MMIS. The fourth step is submitting necessary documentation to complete the enrollment process and provider agreement information. And the fifth step is to affiliate and terminate affiliation with individuals. So we'll go ahead and go through each of these steps and provide some additional information and resource. But before we get started, it's important to know that providers will need to begin with the group enrollment first. Because your enrollment doesn't exist for 1915I, in order to affiliate an individual to a group, you will have to submit your application. The application doesn't necessarily have to be approved, but it does need to be submitted in order for provider enrollment to affiliate individuals with your group. You'll notice here that on this slide, I have highlighted steps 4 and step 5 under the organization and steps 4 under the individual. Steps 4, if you're an individual, you will submit your documentation that you need to complete to your organization. And if you are an organization, you will be responsible for submitting the documentation to provider enrollment. Also, step 5 is a responsibility that is the organization or group responsibility and not a responsibility of the individual. So step 1, what is an MPI? An MPI is a 10-digit numeric identifier. It does not change even if you change your name or your address or any other taxonomies. So basically, what I like to kind of do to help people mind map this concept of an MPI is it's like your Medicaid Social Security number. Essentially, what it does is it helps to identify providers uniquely in the Medicaid system. Before applying for an MPI, you will need to know if you're going to need an individual, an organization, group NPI, or both. And individual providers will basically be the employees. So if you're wondering which one do I need, if you're employed with the agency, you're going to need to apply for an individual MPI. If you are the employer that will be affiliating individuals underneath you to provide services, you will need the organization MPI. And if you're a sole proprietor, you will need both. There's information about the MPI that can be found at this link here in the presentation. Also, a frequently asked questions list that you can refer to when you are going through the process of enrolling for the MPI. Before applying for an MPI, you do need a taxonomy code. And taxonomies are identified as are described as being basically the type, classification, and the area of specialization. So the taxonomy code that you have identifies, the area of work or the classification or specialization that you do. 1915I services have all been identified to have specific taxonomies. And in order to bill for the services, you will need to identify the taxonomies that you will be using as or in the MPI application. There are links to the taxonomies in this presentation. So one link for the individual as well as one link for the group. And then in this presentation as well, we have included the group provider type, specialty code, and taxonomy code for both the individual and the group. And this information right here is a great reference point. We try to make sure that we included reference points to the taxonomies throughout the different resources. But if you're not able to access it online, you do have it here inside of the PowerPoint. So there are 3 ways to get an MPI number. The first 2 ways are the ways that we're recommending to go forward. The third option is something that doesn't apply for this purpose. So the first option is the web-based application, and the second option is a mail-in paper application to the MPI enumerator. The web-based application is what's recommended by CMS. And if you're already enrolled to provide services with Medicaid and have an existing account or an NPI number, you'll need to go in and update your NPI number with the taxonomy code. If you're not already enrolled, you'll have to create an online account. And we're going to go through a couple of steps here to kind of guide you through what this process looks like. To complete the online MPI application, you must first obtain an identity and access user ID. You obtain this by going to the NPPES website. We've included the link here in the presentation. The NPPES website is going to ask you to accept terms and conditions. If you accept, it will move you forward. If you decline, it will not. Once you accept, you will be asked to create or manage an account. So select the Create or Manage the Account button. You'll be redirected to the Identity and Access Management System. And again, you'll be asked to accept or to decline. And then you'll log in to this system by creating a new account. CMS does this because there are several systems where this login information is shared. So the identity and access management registration helps individuals to log into all three of these. After you've gone through the steps and you've completed your identity and access ID registration, you will be able to log into the NPPS website and complete the application online for the MPI. The paper application form can also be found online via the NPPS website, and we'll make sure that we post this link as well so that you'll have access to it after this presentation. But the paper form is a slower process. It does take time for the enumerator to go through and to approve these. I would also say that if you're interested, it's nice to check out the paper form because it goes through and it actually identifies what some of the information is in the MPI application, and it's the same application, it's the same information. So the online and the paper application mirror each other. So if you're not sure and you haven't logged in, just to kind of get a good idea, or even as you're directing the staff that you're working with as they're going through this process, the paper application will help you answer any questions on what you need to have available to complete the MPI. The MPPS website is really kind of your hub for all of your information. So if you're looking for resources regarding the frequently asked questions, if you're looking to get any information on the paper application, as well as any tips, CMS has identified the resources towards the bottom of the page here. We've also included the link to this website within the presentation. So now I'm going to go ahead and pass it over to Janelle. Janelle's going to go through the North Dakota Medicaid enrollment process.
Hi everyone, this is Janelle. I'm going to walk you through the rest of the steps to enroll. So step 2 is to complete the provider enrollment checklist, and you want to do this prior to completing the online application because the checklists have a lot of things that are going to help you while you're filling out the online application. The provider enrollment checklist can assist with collecting the information that you need to enroll in that online application. Group and individual enrollment checklists can be found online starting September 1st. They will include a chart of taxonomies, much like you saw earlier in this presentation, for both the individual and the group applications. These charts will help when you get to the online application in step 3. Groups will be required to submit a group level attestation for each 1915I service they are enrolling to provide. These attestations will be due at the original enrollment and again at revalidation 5 years later. If the record is closed for any reason and then requested to be reopened, the attestation will also be required to reopen the record. Additional documentation that is needed is dependent on the service type, provider type, but will be listed on the checklist and the pages below the checklist. Frequently asked questions or FAQ section can be found at the bottom of the checklist, so you'll want to scroll down past the checklist and see what other resources you have available to you down there. Next slide, please. So this is an idea of what the checklist will look like. They will all be fillable forms, so you will have the option to type them online using the free version of Adobe Acrobat. Next slide, please. So now we're on to step 3, to complete the online application in the MMIS web portal. The online application is filled out and submitted through MMIS. There are links in the presentation, so have access to that once this is posted. Make sure to review the online application guide before you start the online application. It gives tips about saving and navigation of the online app, as well as information for each page of the online application. It's a walkthrough, it goes page by page, so it's a great resource. Once you do the application, once you click save, the system will assign your application an application tracking number, also called an ATN. Make sure you write it down. This number you can use to recall your application if you are unable to finish it in one sitting. If it errors out or times out, this number is going to be of great help to you. The ATN will be displayed in red lettering on the top left of the screen when you're in the application. There are a couple issues that you may run into while completing the online application, depending on the browser that you're using. If you do run into anything that looks strange, please review the FAQ that is posted on the provider enrollment website. Under the frequently asked questions, it may be able to give you guidance on how to run through these. Next slide, please. This is the online application homepage. Over here in box 1, Become a Provider, it has links to both the group online application and the individual online application. In box 2, Recall a Provider application, that is where you would recall an application that you had saved but not yet completed. You just put in the application tracking number and the Social Security number for an individual application or the EIN for a group application. In box 3, the application status is where you can check the status of an application that you have submitted. Next slide. After you click on either group provider enrollment or individual provider enrollment, you will come to this page. This page has instructions on the application. Make sure to read through these and then click continue to move on to the next page. Next slide. This is the provider acknowledgement. Make sure you read this carefully. If you agree, click accept. If you do not agree, click decline. You will not be able to submit an application if you do not agree. Next slide. The online application guide is a step-by-step guide that walks through each screen of the online application for both individual and organizational group providers. Over here in box 1, it shows the application links on the left side of the online application, and it shows you the different pages of the online application that need to be completed. Box 2 is the help section, and this is available in every page of your online application, and it gives you more information about the fields on the page, formatting information, what needs to go there, things like that. In box 3 at the very bottom, it's got an option to save or continue. Make sure that you click save at the bottom of every page before you click continue. And after you click save, make sure that you look at the top left of the application to make sure it has saved successfully. If you've missed anything, it will let you know that it has not saved, and it will usually tell you what needs to be fixed. When you first click save it and it saves successfully, it would also display your application tracking number in the top left corner. Next slide. We also have video walkthroughs available for the online application. Each page has a walkthrough video, so you can watch them all, or you can just watch the video that corresponds with the page you're having an issue with. The link to the video tutorials are on the bottom of this slide. Next slide. Okay, now we're on step 4, which is to submit the documentation. The online application does not have the option to submit the application, so make sure that you follow these steps. The document and forms that are required vary depending on the type of application, whether it's an individual or group, and the type of provider, whether you're doing care coordination, peer support, housing support, etc. Please consult the checklist for your application's requirements. So there's the documents portion and there's forms portion. Documents are documents that are already in your files, such as licenses, federal tax letters, bank letters, etc. And the requirements for what you need to send in vary depending on the type of service that you'll be providing. The forms section, you can actually get these forms online. The provider checklists have links that can send you directly to the forms. You just click on them and it'll open them up for you. Make sure that you complete these forms and sign any forms that are requiring a signature. Next slide, please. This is the Medicaid Program Provider Agreement, the SFN 615. This is required to be completed by all providers, and we need one per application. For individual applications, this is to be completed by the individual whose name is on the application. For groups, this is to be completed by someone who is authorized to sign on behalf of the business. I'm going to highlight the different sections that are in here, but make sure that you always read this very carefully before signing. In Part 1, participation, make sure that you select both Medicaid fee-for-service, which is traditional Medicaid, and Medicaid expansion. Additional guidelines include Section 2 compliance with Title VI of the Civil Rights Act and all requirements imposed of the Department of Health and Human Services, 45 CFR 80. 3, contact information. 4, professionalism. 5, record keeping. Please note that group providers are responsible for maintaining records of individuals and organization group requirements, and upon reasonable request. Individual providers are required to maintain records for 7 years and will provide immediate access to records at the provider's expense. 6, accurate billing. 7, overpayment. 8, secondary payer. 9, full payment. 10, ownership. 11, advance directives. 12, provide screening of hired staff. This includes upon hire and ongoing. 13, enrollment. 14, duration and termination of agreement. 15, certification. And 16, effective date of agreement. Information attested and agreed to is subject to verification through auditing practices. Make sure to read each section carefully before signing. Next slide, please. As I mentioned before, the documents cannot be submitted through the MMIS system, so make sure that you send them either by standard email, fax, or standard mail. All documents must be received by provider enrollment within 5 business days from the date the online application was submitted. If not received in time, the application will be canceled. You can check the status of your application to determine if the documents have been received. If it says penned, no documents have been received. If it says canceled, the application has been canceled. If it says in process, the documents have been received and the application has been placed in the queue to be processed. Applications are worked in the order the completed documents are received. With those 3 options, if you do choose standard email, please do not submit any EFT banking information, social security numbers, or dates of birth by an unsecure email. Make sure you use an encrypted email for those pieces of information. If you do not have access to an encrypted email, please feel free to email provider enrollment at that dhsenrollment@nd.gov email address right there, and we can actually send you back an encrypted email for you to just reply and attach the documents to. If you choose standard mail, please note that all documents sent by standard mail are still subject to the same 5-day business rule. Mail takes time to be routed and may not reach provider enrollment before this deadline has passed. Next slide, please. So now we're on step 5. So the provider's already enrolled and now you're looking to affiliate or disaffiliate individuals. So what does it mean to affiliate and disaffiliate an individual? Affiliation is the process of assigning an individual provider to the organization group that is billing for that individual. This affiliation must be made in the system for claims to pay. Once enrolled, organizations are responsible for affiliating and disaffiliating individual providers when they no longer work for them. To affiliate an individual with an organization, the organization needs to send an affiliation form called SFN 1330-1330. If you have multiple individuals that need to be affiliated, submit one form per individual. To disaffiliate a provider who is no longer working with an organization, the organization needs to send a termination form called SFN 1331, that is 1331. This will terminate the affiliation with the organization in our system. If you have multiple individuals that need to be disaffiliated, submit one termination form per individual. There is more information on affiliations and terminations on the provider enrollment page. The links are below on this slide. There's even a sample affiliation form that shows you how to fill it out. Next slide, please. So this concludes the presentation portion of our provider enrollment orientation. We would like to answer any questions you might have at this point. Please feel free to either unmute yourselves or type your questions into the chat box and we will be happy to answer them.